I was talking to Pascal yesterday.
Akeem, are you drumming?
A little extra.
Thank you.
You're welcome. I got you. Good morning, Commissioners, and welcome to the Wednesday, January 5th, 2022 Board of County Commission meeting. I'm Akeem Ashford, Director of Communications. As COVID-19 positive cases continue to rise, we wanted to give you an update on Sedgwick County's continued response to this pandemic. I would like to bring up Deputy County Manager Tim Kaufman to the podium to give you that presentation. We will also have Dr. Gerald Menz on Zoom to provide an update on the Omicron variant of the COVID-19. Tim?
Morning, Tim.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. I'll be very brief, but I wanted to provide you a bit of an update as to where things are going with COVID right now. In terms of vaccination, we have an eligible population, 5 and older, 481,000 individuals. Of those, 58.1% have received one dose, and we've got 53.2% of the eligible population that is considered fully vaccinated. They've had 2 doses or the single Johnson & Johnson dose. And then we've also got 18.6% of that population that has received a third or a booster dose. If you look at the entire population of the county, we've had 54.2% receive one dose, just under 50% receiving 2 doses and being considered fully vaccinated, and then 17.3% with a third dose or a booster dose. And we continue to offer vaccines at the 223 North Main. We've got mobile clinics multiple times each week, sometimes multiple times each day. We're trying to make sure that we get the vaccine available where people are at, and we want to make sure that people understand how important it is to get the vaccine. Dr. Menz will talk a little bit more about that, but it has, particularly over the last week or so, driven a demand for testing that has increased. The chart here shows you early December at our East Harry site, we were testing about 130 people a day. We peaked just before Christmas because I think people wanted to make sure that they were okay before they saw their families. 342, average 342 a day. This past week we were averaging about 300 a day. But there is an increased demand for testing across the community. I think there's some confusion about how to get tested. Here's the information about how people can get tested through the Sedgwick County site, but I want to emphasize that we are certainly not the only site that offers testing. If you do want to test, if you'll text SC COVID test, the number right there, it'll get you in line, and then you'll be notified how long it'll be before it's your turn in line. But it's important to get in line early. The line opens up at 8 o'clock, and those appointments, those slots fill up quickly, so we encourage people to get in line early. KDHE has added a testing resource at the end of December. They opened up a testing site at former Chester Lewis Academic Learning Center in 67214 zip code. to get in line for them, we've got a link right here. But that's an additional testing site now in the community. And then I also want to point out, Know Before You Go Kansas. That is another opportunity for people to understand how to get tested. Sedgwick County website has testing information, a number of different providers in the community, some commercial, some safety net, in addition to the health department. And then the
Hi, is
state
Adrian in the office?
Kansas has a, we may want to mute Dr. Menz if we can.
Is she working today?
Dr. Menz, can you hear us?
Dr. Menz, can you mute for a second? Know Before You Go also has a testing locator for people. They can
There's
put
no
in their
audio.
address and it'll bring up a number of different options for testing.
I can't hear
And finally, I wanted to talk a little bit about some of the new information that's come out from CDC and KDHE in regard to quarantine, isolation and quarantine. And so the health department on their website has two nice graphics that help people understand what those changes are in regard to isolation and quarantine. The biggest change, some very significant changes. Healthcare workers in a hospital setting, there's a demand and a pressure for healthcare workers because we've seen such an increase in hospitalizations. Healthcare folks need to get back to work maybe a little bit more quickly. So the guidelines here explain under what conditions and circumstances healthcare workers working in a hospital setting that test positive or are a close contact, the circumstances under which they can return to work a little bit more early than they had in the past. And then there's also another document that talks about the general public, and it's laid out the same way, isolation and then quarantine. But it's new information. It does shorten the isolation and quarantine recommendations for individuals, with the exception of people who work in congregate settings. So it does not yet apply to schools. It doesn't apply to correctional facilities, group homes, things like that. Those individuals are still recommended to follow the 10-day or the shortened 7-day with testing, isolation, and quarantine guidelines. And so it's new information. We've tried to put it in a friendly, easy to read format for individuals that need that information. Most importantly, if you feel sick, stay home. If you feel sick, get tested. But follow those isolation and quarantine guidelines so that we can slow the spread and decrease the pressure on the hospital. And I guess one final comment I wanted to make is that when we talked to our hospital partners this week, they wanted us to make sure that we encourage people to not go to the emergency rooms for testing. The emergency room is not an appropriate place for COVID testing, and so there are lots of other testing options. Please don't go to the emergency rooms for testing. Be happy to answer any questions, and then we'll turn it over to Dr. Menz.
A couple of questions here. Commissioner Dennis?
Thank you, Mr. Chairman. A couple of things. Just before Christmas, at our last meeting that we had at the end of the year, we made a motion to allow the chairman to sign out a letter to the state if the MDL wasn't funded as it had been in the past. And so I just need an update on where that's at, because I don't believe we sent a letter, and I don't know what the state's doing about funding the MDL.
I don't have information to give you right now on how that arrangement between the state and the MDL is. I will let you know that we continue to use, that health department's collection site continues to use the MDL because of the fast turnaround that's available there. And we continue to have conversations with WSU about how that payment process is going to work out, but we haven't received any formal update from the state yet about that.
Okay, well, can you check with WSU and see what the status of that is? Because the last we heard before Christmas was that they were going to cut off all the funding to the MDL, and then they wanted us to do all the testing up at the new state lab that they were creating. And we've invested a lot of money in the MDL, and I don't want to see us lose that opportunity. And besides, the MDL can turn it around here locally in 4 hours, and if we've got to drive it to the state, it's a day or so before we're going to get the results back. So I just like a little bit of feedback on what's happening with the MDL.
We'll follow up with them.
Okay, the other thing that I've got real quick, the queue list works. I want to let you know that. It doesn't work real fast because there's a lot of people trying to get tested. My wife wanted to get tested yesterday morning, and so I said, well, we'll just sign up for the queue list. The first time we went in was about 7:30, and evidently they don't turn on the queue list right away, and it said nothing was available during the day. So I don't know what time they turn it on, but they may want to turn it on a little bit earlier. So then at 8 o'clock I tried again, and actually I was able to get her in, but it was 338 minutes. So, I mean, that's right at 8 o'clock. So if you don't sign up, one of your charts here said call early. Well, that's true, because at 8 o'clock, why, it was 335 minutes to get in. So, but she was able to get in yesterday about 3:30 in the afternoon. And the testing went well. She said they were very polite over there. The only question that I had is that she was going to take the saliva test, and they told her that the saliva test wasn't accurate, and so they gave her a throat swab. So I need to know why that we're telling people. Is there something that we aren't aware of? Because I've been told all along the saliva test is just as accurate as the nasal and the throat test.
I'll follow up with staff and see what that message is all about.
Okay. Thank you, Mr. Chairman.
Commissioner Cruz?
Thank you, Chairman. Thank you for this report. The biggest thing I think we're hearing is staffing. Staffing challenges, staffing shortages. I had a constituent call me about, she used the queue list line and went and got tested at the health department, and she just mentioned how incredibly tired and our staff looks. So how are we doing as a county with our staffing?
We're just like every other employer right now, and we're affected by isolation and quarantine rules for our staff as well. Over the holidays, I think some of the staff that we use at, particularly at the testing site, were exposed, and so that appropriately they're quarantining, and so we're dealing with the same thing that every other healthcare provider in the community is. We continue to utilize temporary service firms and bring people in as best we can. Everybody's short-staffed right now, and so we're utilizing all of the staff that we have in the health department, moving staff potentially from the clinic or from the vaccination site to testing. We manage our workload based on where we think the greatest need is going to be on any given day.
I was listening to a Kansas City hospital call this morning. They said they had 180 people call in today alone. So I guess asking the community for patience when, utilizing these services, because we are experiencing a staffing shortage. So thank you for that answer. That's my only question, Chairman. Thanks.
Commissioner Howell?
Thank you, Mr. Chairman. I have a little bit of email I would like to share with manager that you could disseminate to my colleagues here, but I have some information regarding some of the capacity and issues that are impacting, if you will, the MDL that we invested $4 million in. They can do up to 10,000 samples a day, but they're not getting there because, as we all know, there's a staffing shortage, and the bottleneck is the collection part of this, not the processing part. And I think right now the testing is such an important part of people getting information quickly so they know what to do. It's a key part of combating the coronavirus here in Sedgwick County. Is there anything we can do? Can we reach out to the MDL and see if there's anything we can do to direct some staff to assist, or temporarily assign some people to do some things to help collection, or create another site on for 1 month or something? I think there's things we could do to collect those samples. I know people. By the way, I just did the texting a minute ago to see if I could get in line, just because I want to see how it worked, and it came back and said that they're full for the day. That was at the top of the hour. So, to Commissioner Dennis's point, the queue list thing is great, but it's not working for lots of people here. And there are people here in the community that are having to wait 3 or 4 days to get a test now.
And that's why we wanted to make sure this morning that we talked about all the other folks that do testing as well. The health department is not the only testing resource in the community, and so we've got resources on our website and that Know Before You Go state website that would help people understand where else they may go.
A couple of comments to that, Commissioner. And to Tim's point, like at the state testing facility yesterday, they did not do capacity. They have capacity there to do 200 tests per day, and at some point yesterday afternoon, pretty late, they'd only done 125. So there are a number of options out there. To get to your first point, and I know Commissioner Lopez was also having some conversation yesterday with Tanya Witherspoon at the MDL. But Tammy Bradley, who is with Bothner Bradley, put out a correspondence yesterday to all businesses. And her message was that over the course of time, the MDL has 200 businesses plus that are affiliated with them that can collect sampling at their site. Sedgwick County is one of those businesses, for example. And they can collect sampling at their site and transport it to the lab, which has tremendous capacity, as you bring up. And we had gotten out of the habit of doing that during the lull. And so her message yesterday is we need to do that again. All employers who have the ability to test at their site, collect the sample at their site, should do so and then transport it to MDL where the lab capacity is there. So according to Tanya Witherspoon, there were several hundred kits passed out yesterday. So the big employers are getting back into the habit of doing that again, as should we as the county. If you're a county employee, you should test with us. We will transport it to the MDL for you versus going instead and clogging these lines up. So there is a strategy already in play to alleviate some of that pressure. And now, Commissioner Lopez, if you want to talk about an additional site or what your conversation was.
Sure.
May I ask a question at some point? I need to respond to your comment as well. Okay. So do you want me to do that now or wait after Commissioner Lopez?
Well, I can respond to your first question. So I've been working with Tanya on just that because, I mean, we've seen lines that are just extremely long and people are waiting, and it's frustrating for everybody on every side of this. So they have the ability to create a new testing site for 30 days or however long we need at their West Campus on Mays Road. The problem is they're kind of in limbo to know if KDHE is going to pay for it or not. So I think if we can say that we're comfortable saying that if KDHE doesn't pay for it and we will cover those costs, then they are ready to get that site set up. They have the workforce already ready to go. We just need to make sure that it would be paid for. And then they don't have a queue system like we do. And so we are working with our IT people and WSU's IT people to get them on the same queue system that we're using to use at their lab. So the lines aren't just pull up and wait 3 hours in line. It'll be just as done the same way that we're doing it at our site. So I think that'll give us an ability to do much more testing every day and hopefully alleviate some of the waiting that we're seeing today. I can foresee this being an issue for the next 30 days or so with this new variant. So if we can get it at least for that time frame, I think it would make a lot of sense.
Thank you for those comments. And again, you might have the same email that I have. I only see myself as a recipient, so maybe you got the same email. I don't know. She does talk about a West test site that they would like to stand up, and she does talk about there's confusion about the payment on that. She also makes a comment, there's many of registered testing partners, that's the businesses you're referring to. There's not clarity right now whether or not this is on their own cost or whether there's reimbursement. So she makes that comment in here as well. So there's confusion on that aspect. I think that, again, the businesses could do it. We need to clarify to them what their liability is.
Let me comment on that, Commissioner. In the correspondence from Tammy Bradley yesterday, it was in bold print that those costs will be paid for by the state. So they tried to clarify that. I think any message we can put out to corroborate that would be beneficial. But that is true. But there's measures being taken to clear up that confusion.
And I guess my final comment would be this, as I texted in to see if I could get online, I got this response that says, the testing line is full for the rest of the day. Locate other testing sites at, and there's nothing after that. So it's not directing people to a solution. It's simply dead ends right there. So we need to have someone take a look at that. Thank you.
We will.
Okay. Commissioner Lopez.
Thank you. With the state testing site here, are they only doing don't even, the gargle test, is that the only test they're doing? Because I've heard that families have gone in with young kids and they've really struggled to even be able to test because they are not able to rinse that around for a minute at a time.
My understanding is that they're only doing one sampling method at that site.
Okay, so maybe, just if anybody's watching, if you have a kid that's under 5, it might be easier to not utilize that one because it is a harder one. And I have heard that wait times have been about 5 days, again, if we're going through the state, so just keeping that in mind. Do you have any update on boosters for kids under 16? I know that's being worked through right now, but any idea when that could potentially be available in Sedgwick County?
I do not have that. We're still waiting on that from CDC and the ACIP.
Okay. And the only other thing I have, one issue that I've been hearing from a few people is just the concern on public transit trying to get to testing sites if people are using that. I mean, besides masking, is there anything else we should be telling people to do to be careful when they're on public transit to get to a testing site? Or do we have any idea, or can we get a list of sites that are close to a bus stop that might be an easiest place to send them?
I guess for individuals in that situation, in that set of circumstances, we'll look at seeing if we can do something with the city bus map. But again, that know before you go allows you to put in any address you want, and then it shows you what's closest by. And I think if people are bus users, they probably know the best way to get to those things. Absolutely, people should be masking when they're out. And again, we'd encourage everybody to get vaccinated.
Okay, perfect. Thank you.
Okay, thanks, Tim, for the update. So we will move to Dr. Mills.
Yeah, I think Dr. Mintz has been having some audio trouble. Let me turn him up here. He was not getting audio on Zoom. Dr. Mintz, are you on the phone here?
Can you hear me now?
Yeah, we have you, sir, yes.
Okay. Unfortunately, the Zoom link was not working either by video or audio, so I'm calling in on the phone. I apologize.
Okay, we can hear you, Doctor.
Okay. Well, I'm here to probably tell you what you already know. But I want you to know that we are at the point we had all hoped would never occur. Ever since this pandemic started, we were hoping to avoid this situation, but we were at the crisis. I've had numerous conversations with our hospital partners in Wichita. I was participating, or at least listening into KU Medical Center's briefing this morning, in which they had invited about 20 physicians, chief medical officers, and hospital administrators from across the state, including Dr. Antonios from Wichita, to give an update on the status of their hospitals. The hospitals across the strait, not just in Wichita, are at crisis level. The number of cases of COVID has rapidly risen in the last week. The number of positive tests in Sedgwick County has gone up dramatically in the last week. The hospitals are at capacity from a sense of staffed beds, and we have high numbers of staff who are off work because of illness or quarantine. KU Medical Center has over 700 staff out today, an increase of 100 from yesterday. So a combination of rising rates of COVID, staff illnesses, the hospitals are at capacity. Rural hospitals included, and rural hospitals are not being able to transfer critically ill patients into the tertiary care centers. So the whole state is in a state of serious crisis, and the fear is that influenza is starting to hit the communities, that we have not seen the peak of influenza, and we don't think we've seen the peak of COVID. So we're already at a crisis level, and we anticipate that the numbers will continue to climb over the next few weeks. So we're in a very serious condition. All the hospital administrators this morning at the conference were very worried about what will happen in the near future. they're very worried about people who have non-COVID illnesses getting care. I think there's a consensus among the healthcare providers, based on what I heard this morning, that this is in large part due to the fact that Delta is still here in town and in the state. Omicron is starting to come into the state, and we know Omicron is more contagious. People need to quit hearing about that it's not as serious, because its higher contagion rate is leading to the same number of people who are critically ill. And people should not be reassured by the fact that, yes, it maybe is not as likely per person to cause critical illness, but it's so much more contagious. The actual number of patients who will be critically ill is probably about the same as with Delta. The other problem that we all agreed upon is hardly anyone in any of the communities across the state is masking. Hardly anyone. Hardly anyone is doing any time of physical distancing. I had the occasion to go to the post office over the holidays to mail some packages, and there was absolutely no physical distancing. The line was face to back, face to back. Same as occurring in other places. There's no attempt by businesses to keep the checkout stands distance. I think most of us agree that most of the public health interventions that we've been recommending for 2 years is not being adhered to at this point. And so this is what we have now. Hospitals at crisis level, cases rising quickly. So I'm here mainly just to tell you the status of things. If you have questions, I'll take them. That we need to do whatever we can to get more mask wearing, return to physical distancing, all the things we've been talking about for 2 years. Do you have any questions?
Okay, any questions from the commission? Dr. Menz, thanks as always for being here and sharing that kind of that statewide report.
Well, you're welcome, but I'm very sorry I have to be here. Extremely disappointed.
Okay.
We had all hoped by 2 years this thing would be over. It's not over. It's just beginning.
Well, we want to encourage also the vaccination, I assume, right?
Absolutely. Unfortunately, our vaccination rate has been pretty static.
Yeah.
Despite all of our admonitions, I'm afraid there's this feeling by many out there that the vaccine is still unsafe, and we've struggled with what to do to dismiss that fear. And I apologize for not mentioning that also, but we're very frustrated about why so many people are just absolutely unwilling to get it.
Right. Okay, well, hopefully what you've just shared can be rebroadcast and for the public, at least here locally, for us to hear and share. So thank you, Doctor. It looks like there's a question from Commissioner Lopez.
Hi, Dr. Menz. Thank you. I just had one question. Can you go over or give us your opinion on if this variant is affecting children at a higher rate than past variants have? It seems like our pediatric cases have gone up, and looking at least at Kansas City, their rates are pretty high within the pediatric units. And I'm speaking to a couple of pediatric physicians in the last couple of days. They're all concerned about it. So I don't know if you could just touch on that real quick while people are paying attention.
The Omicron virus has not hit Kansas until about 2 weeks ago, so we really didn't have much local experience with it. All we have is the experience with other countries and other states that have seen more of it. So I can't give you any explanation why. We're seeing more pediatric cases in the hospital. After a case is diagnosed and the sample is sent in, it takes a little while to get back, whether it's Omicron or Delta. You don't get that answer immediately. So I think over the next few weeks, as we learn more about the difference in pediatric cases between Delta and Omicron, I can answer your question better. Nevertheless, we are seeing more kids in the hospital. Now, not near the level of adults we're seeing, but we're seeing more kids than we did in the past. The other thing I want to mention is, as you recall, last December, January, February, we had hardly any influenza. Hardly any. Some hospitals saw zero. We attributed that to the fairly good compliance with mask and physical distancing. Already, we're seeing influenza A here and in Kansas City, which we think is another manifestation of the fact that masks work, and it just really disappoints me when I hear people say there's no evidence that masks work. Maybe it's not as good of evidence as high-level research in a laboratory, but certainly it's hard to ignore the fact we hardly saw any influenza, even though we didn't have 100% mask wearing. We had a lot better than we have now, and now we're already seeing it. I expect, as you note, Ms. Lopez, that influenza usually hits the kids pretty hard. We usually have kids in the hospital with influenza. So at this point, it's hard for me to tell you whether these are all influenza cases or COVID cases, or actually KU had a patient with both, influenza and COVID at the same time. So I hopefully I can tell you a little bit more maybe at the end of this month when we have more data back about which cases are Omicron and which are Delta.
Thank you, I appreciate it.
Okay, thank you, Dr. Menz. Maybe if you come back 2 or 3 weeks from now, or by the end of January,
Yeah.
let's get another update.
Well, in light of our technical problems, I'll try and be there in person.
Okay, all right. Happy New Year to you.
You too, thank you.
Okay. Moving on. Did we have anything else, Akeem? And then we'll call the meeting to order.
All right, Chairman. Yeah, we do have one other thing we'd like to let our public know about. Let me just get out of here really quickly. Okay, next up, Commissioners, Sedgwick County Environment Resources is once again providing a number of drop-off sites for Christmas tree recycling. After you enjoyed your real Christmas tree this holiday season, take it to one of the many locations around Sedgwick County between December 20th and then January 21st to be converted into mulch. And then while you're there, please pick up some mulch yourself. We've got that graphic here for you to view. All of this information is online on the Sedgwick County's website, as well as our social media pages. Commissioners, looking at today's agenda, you will review the resignation of SARA DIXON from the Sedgwick County 4th District Advisory Board. Under new business, Tanya Kohler will present Sedgwick County's CIP real estate purchase agreement project. You will hear a resolution declaring it necessary to acquire a site and the structures there within for purposes of renovations and improvements. And then a report of the Boards and Bids and Contracts regular meeting on December 30th, 2021. Chairman, with that, I'll turn the meeting over to you.
Okay, thank you. And good morning again. And with that, we will officially call the first meeting of 2022, Wednesday, January 5th. Sedgwick County Board of County Commissioners. We'll call that to order. So, Madam Clerk.
Invocation to be observed by a moment of silence. Please remain standing for the flag salute.
Next item, please.
Roll call. Commissioner Lopez?
Present.
Commissioner Dennis?
Present.
Commissioner Howell?
Present.
Commissioner Cruz?
Present.
Chairman Meitzner?
Present. Next item, please.
Public agenda.
Commissioners, we had a message that we did not receive any public comment by email as of last night, and we do not have anybody signed up today, so we will close the public agenda with no participation. Next item, please.
Consideration of minutes. Item A, special meeting minutes of November 19th, 2021.
Commissioners, as has been my customary is, if it's all right with you, I'd like to combine items A, B, and C, which is the minutes of special meeting November 19th, regular meeting of December 1st, and regular meeting of December 8th. If you've all had a chance to review those, and if there are any corrections or questions about that, I'll make a motion that we approve all the minutes.
Second.
There's a motion and a second. I don't see any comments, so Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis? Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye. Next item, please.
Appointments. Item D, accept the resignation of Sarah Dixon from the Sedgwick County 4th District Citizens Advisory Board.
Mr. Papoon.
Mr. Chairman, Mike Papoon, County Councilor. Item D is the resignation of Sarah Dixon from Commissioner Cruz's Citizens Advisory Board. Ask you to accept the resignation.
Commissioner Cruz.
Thank you, Chairman. I want to thank Sarah for her service on this board, and I'll make a motion to accept the resignation.
I'll second that. Any questions, comments? Being none, Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye. Next item, please.
New business. Item E, real estate purchase agreement for Sedgwick County CIP Project 470.
Okay. Good morning, Assistant Manager Tanya Cole.
Good morning, Chairman and Commissioners, and Happy New Year. Tanya Cole, Assistant County Manager. I am here this morning to seek approval for real estate purchase of 2716 West Central, which is where we currently lease and occupy our Sedgwick County Health Clinic. So as mentioned, we do currently lease this facility and have been since 2005, and so we've been there approximately 17 years. This is a 13,000 square feet. Really apologize for that.
That's all right.
This is a 13,000 square foot facility.
Why don't you hold on, Tanya? Apologies to the public that may be listening or watching. We'll correct this here shortly. There we go. Back to the show.
Thank you. Okay, sorry, a little distracted there. Okay, this is 13,000 square foot facility. Back in late 2020, we did some programming with the health department and health clinic, and they had outgrown, or they are outgrowing their existing space there and functionality. Most of that is storage spaces and an overextension with their staff and supplies. And so through that programming, it was noted that they needed approximately an additional 3,000 square foot additional space there. So again, this, as I've mentioned, this facility is leased, and so part of the problem there is we can't do any structural changes there with alterations because that space is leased. And currently at that location, we are annually spending about $79,000. That's just an annual rent. In addition to that, we are paying property taxes, utilities, and then paying for maintenance and repairs at this facility. So just a picture there. You are all familiar with this facility, so just a picture there for the public to see, which they may be familiar with this location. So in 2022, we had a CIP for this location. It's the Health Department West Central remodel. It's a $3.6 million CIP, and that was to renovate and expand the facility as needed to meet the client's program client base. So what we have before you today is a real estate purchase agreement for $875,000 to purchase this facility with $10,000 in earnest money payable within 5 business days of the full execution of the contract. With this agreement, it allows 45 days due diligence period for us to go in there and do some inspections of the building. With the remaining 2.7 million, we would do some remodeling to the existing areas and expand the facility to include an addition of 4 exam rooms, expand the lobby and storage area, and as well expand the parking lot and do a mill and overlay of the current parking lot, and then do some exterior work. So let me show you a little bit of what that expansion might look like. On the left there is an aerial view. So we've got the building here on the left. You'll see the current parking lot, that's in gray. To the left there in that grassy area is where we would expand the parking lot. So on the right here in the orange is where we're going to expand. So on the bottom here is where we would expand the lobby and storage space. And that up here kind of to the left on that wing is where we would expand the lobby rooms. Then to the left in the dark gray is where we would expand that parking lot area. So I'm happy to answer any questions, but at this point I would recommend the chairman to sign the purchase agreement, transitioning the county into a 45-day due diligence period to inspect and verify the conditions of the facility with a closing date of on or before February 28th, 2022.
Okay. Commissioner Cruz?
Thank you, Chairman. So will you guys be resurfacing the whole parking lot?
We will, yes.
Okay. All right. I guess if there's no other questions, I'll make a motion to approve.
Okay, and just to make sure, this is the expansion of the Sedgwick County of our health department.
Health Department clinic,
Right.
correct.
So not to be confused with some of the stuff we're doing with the mental health and substance abuse efforts. But but this is a really good move forward for us, for our health department. So with that, back to you, Commissioner Cruz.
Motion to approve as presented.
I'll second. So motion and a second. Any other comments? Being none, Madam Clerk, please call the roll.
Commissioner Lopez.
Aye.
Commissioner Dennis.
Aye.
Commissioner Howell.
Aye.
Commissioner Cruz.
Aye.
Chairman Meitzner.
Aye. Motion carries. Next item, please.
Item F, a resolution declaring it necessary to acquire a site and the structures located thereon for county public building purposes and make renovations and improvements thereto, and providing for the issuance of general obligation bonds to pay the costs thereof.
All right, good morning, Commissioners. Lindsay Poruso, your CFO. I am actually just here to introduce Garth Herman with Gilmore and Bell, our bond counsel, and he will talk a little bit about the logistics for how we're actually going to finance the purchase that you just approved.
Okay,
So,
thank
Garth,
you,
I'll
Lindsay.
turn it to you.
Garth, is that a new growth on your face there?
It is,
Okay.
it is.
All
I
right.
had a
Welcome.
week off from shaving, so I decided to just let it keep going.
Okay, welcome back to the commission.
It's good to see you, Chairman, Commissioners, and Happy New Year. As Lindsay mentioned, this is kind of the counterpart to the previous agenda item from Tanya. So that authorized the execution of the purchase contract. This resolution before you now will authorize the county to finance all or a portion of the costs to fund that acquisition of the property, as well as to make those improvements related to the building and parking lot improvements that Tanya mentioned. This resolution is under the authority of the county's Charter Resolution number 69, which was put into effect a few years ago. That charter resolution, as you may remember, authorizes the county to acquire sites for county buildings or structures and parking improvements. It also authorizes the county to make site improvements to those sites, as well as to construct, furnish, equip, improve, or renovate either new buildings on those sites or existing buildings that are on those sites as well, and to finance those costs through the issuance of general obligation bonds. So once this resolution, if it's adopted, that authorizes the county then to go ahead and finance all or a portion of the cost of that acquisition and improvements through the issuance of the general obligation bonds. Those bonds are not yet ready to be issued. They're at the discretion of the Board of County Commissioners, and that decision will be made at a later date as to how much of those bonds will be issued to finance these costs. But in essence, this is your state law authority as well as your federal tax reimbursement authority to allow those bonds to pay for those projects and to reimburse any money that you may spend related to those projects. So with that being said, I'll stand for any questions that you may have.
Okay. Thank you. Any questions for Garth? Okay, I don't see any, so I'll make a motion to approve as presented.
Second.
There's a motion and a second. No other comments? Madam Clerk, please call the roll.
Commissioner Lopez.
Aye.
Commissioner Dennis.
Aye.
Commissioner Howell.
Aye.
Commissioner Cruz.
Aye.
Chairman Meitzner.
Aye. Thanks again.
Thank you all very much.
All right, Happy New Year. Next item, please.
Item G, report of the Board of Bids and Contracts regular meeting on December 30th, 2021.
Good morning,
Morning, Joe.
Mr. Chairman, Commissioners. Joe Thomas, Purchasing Director. The regular meeting of the Board of Bids and Contracts on December 30th. We have two items to present to you. Our first item is Alluvia Software Solution for Enterprise Resource Planning. And this recommendation is to accept the quote from Alluvia Software, LLC, and is for a one-time initial setup of $20,020. And then we'll establish contract rates for a period of 24 months beginning upon the completion of the initial setup and implementation as listed. Item number two, our final item is temp services, data entry, and general office staff. And this recommendation is to accept the proposals from Cambay Consulting, LLC, from Cross Country Staffing Incorporated. They're doing business as Cross Country Healthcare Services, and Interim Healthcare of Wichita. And that's for the rates listed and also found in their proposal responses for a contract period of 1 year with 3 one-year options to renew. I'll be happy to try to answer any questions you may have, and I recommend approval, both items.
Okay. Any questions about these two items? I don't see any. I'll make a motion to approve the Board of Bids as presented. The motion and a second. Any other questions? Being none, Madam Clerk, please call the roll.
Commissioner Lopez.
Aye.
Commissioner Dennis.
Aye.
Commissioner Howell.
Aye.
Commissioner Cruz.
Aye.
Chairman Meitzner.
Aye.
Thank you very much.
Thanks again, Joe. Happy New Year to you. Next item, please.
Consent agenda.
Good morning, Commissioners. Tom Stolz, County Manager's Office, recommending approval of consent items H through Q this morning.
Okay, is there any items need to be pulled for further discussion? If not, I will make a motion to approve items H through Q.
Second.
It's a motion and a second. Being no other comments, Madam Clerk, please call the roll.
Commissioner Lopez.
Aye.
Commissioner Dennis.
Aye.
Commissioner Howell.
Aye.
Commissioner Cruz.
Aye.
Chairman Meitzner.
Aye. Motion carries. Thank you. Next item, please.
Legislative issues.
Good morning, Commissioners. Akeem Asher, Communications Director again. Just give you a quick legislative update. First off, next Monday is the first day of session. I'm going to try to go up next week and then spend more time throughout this session. We've also made a commitment to have both Jessica and Jason from Watkins Public Strategies to present to you on a more regular basis. We will have weekly meetings with Tom, Mike, myself, and Tanya to go over issues of importance. That way we have updates for you every week.
Okay.
In addition to that, Commissioners, last night we had the legislative South Central Kansas Delegation Legislative Forum. Went really well. Showed up. A number of commissioners are also there. We're able to hear issues from the community of importance. Diane Leffler from the Wichita Eagle was also there, and there's an article in the paper today just about those things. In addition to that, Commissioners, tomorrow we have a luncheon where Chairman Meitzner is going to present. We've got a PowerPoint that we prepared for him on legislative issues. We will have palm cards and everything that we've also put together from the agenda tomorrow as well. So I know a number of staff are going to be there as well. With that, Commissioners, I'll stand for any questions that you may have.
Just as a reminder, let's make sure that we get with you and Nicole and Tom, make sure that that PowerPoint gets sent in.
Yes, sir.
On time.
You bet.
To be a part of it.
Absolutely.
And again, it's just our legislative issues that we've agreed upon with the primary purpose is the pushing for the local hospital that we've been talking about, and then all the other support functions for mental health and substance abuse that we've talked about, and then some other things. But I can, as a matter of fact, when we get a copy of that, let's get that to all the commissioners so they'll see that. Commissioner Howell?
Thank you, Mr. Chairman. I wanted to give an update to my colleagues on two issues that I'm working on. One of those is enhancements for Senate Bill 367. I don't know if this was sent out to the other commissioners or not, but we did have a meeting. I know one commissioner did attend, and they came up with, I think, 5 discrete, if you will, improvements that are needed in that legislation that was passed years ago. And so, again, I'm working with some legislators trying to get that bill drafted. I don't know if that's acceptable to anybody here, but I just want you to know I've taken the lead on that. If anybody wants to partner up with me on this or have more information, I'm willing to talk about this, if anybody's interested. I just want to say that. So And the second thing is the driver's license suspension law. I think it was Senate Bill 127, I think it was, that passed. There are some, and again, it's on the platform. It's a very simple statement on the platform, but it does talk about some additional work that needs to be done. I am working with some legislators on that as well. I do want you to know that Pilar Pedraza, I think she's with Cake TV, I believe, but she is doing a very good investigation once again, trying to help us figure out what needs to happen. I appreciate her very much. She's spent years on this now, and I would say that the bill would not have passed last year without her support, without her work. And so I know she's digging into this again. She's doing interviews today, and I know she'll be up in Topeka next week. But the reality is, I guess I would be remiss if I didn't let my colleagues know that there is an investigation on what needs to happen with the driver's license suspension issues of our state, and especially in Sedgwick County. So with that, I just want to make those 2 points clear. Thank you, Chairman.
Okay, thank you for that update.
Chairman, if I could, with respect to Commissioner Howell's first comment, we did send that out, and that did come from the Department of Corrections. Commissioners, if you guys don't have those, we can resend those to you if you guys need those. Those are just the notes from the meeting that we had with Commissioner Howell. So.
Right. It's probably worth, why don't you resend those to us all?
You bet, Chairman.
That'd be fine. Okay, any other questions about legislative issues? Okay. Good luck with your travels up the turnpike.
Thanks.
Okay, next item, please.
Committee reports.
Committee reports. Commissioners, I know December was kind of a slow month, I think, for committees, but anybody have anything to report on their committees they serve on? So I don't see anything. So next item, please.
Other.
Under other, Commissioner Howell.
Chairman, I want to go back and visit a discussion we had a few weeks ago regarding potential sound ordinance or discussion about sound ordinance in Sedgwick County, whether that's something that we would want to take a look at. I've been working on trying to get some data. I love data. I like to do analysis. And back in my private sector job, I spent 24 years testing airplanes and installing sensors and measuring things and doing analysis. And so it's kind of my skill set. So I went ahead and decided to do an investigation on this issue. I understand the complaint, and I went ahead and purchased a sound meter. I did contact the owners of Club Rodeo and coordinated a visit when they were closed. Oh, sorry. See, I'm off. Hopefully, I'm not going to repeat anything I just said. Hopefully, you heard all that. Anyway, I did coordinate my visit with the owners of Club Rodeo, and so when they were closed, it was a Monday evening. And one of the things I did was I asked them to play a really bassy song, if that makes any sense. They picked, I think it's Pink Floyd, Another Brick in the Wall. If you know that song, it's a very deep bass. And they turned it up to maximum volume. And I went both from the sound booth to the dance floor to the lobby and into the parking lot and to the edge of the parking lot by the street and took measurements at those 5 locations. And the highest measurement inside the building, basically right below the speakers, was about 100 decibels. And if you don't know how decibels work, let me just explain. It's a logarithmic scale. So 80 dB is 10 times louder than 70 dB. 90 dB is 10 times louder than 80 dB, and 100 dB is 10 times louder than 90 dB. So if you do the math, 100 is 1,000 times louder than 70 dB. With that information, I was able to get up to 100 decibels on the dance floor. There we go. Right.
Sorry, Commissioner, I just wanted to, since you're following up, yes.
Yeah, so again, they're open basically Friday and Saturday and Wednesday evening, and 4 days a week they're closed. But this was a Monday night. And so I took those measurements, and again, out by the road, I think where it's the most important, again, what bleeds off their lot, I was getting around 65 dB, very low. In fact, when I would speak to kind of just talk a little bit, it would jump up to 75 dB. So it's quieter than my own voice. When a car would drive by down MacArthur Road, it would jump up to around 75 dB. And if you look at a dB scale, they're very available on the internet. You can look for decibel scales and see what a train looks like, or a rocket engine, or a freight train, or whatever. So you can see relevant sound levels. So having done that, I decided to change the music to something a little higher tones, a little bit less bass. And we did the test again and went back the other way. Maximum volume, slightly higher tones, and measured everything again. And all of the numbers dropped off. So in other words, the bass does translate through the air more effectively than the high tones would. And so I think I've captured those numbers. And someone might say, well, maybe you are being Maybe you were being played a little bit. Maybe they turned it down if you left. And so I decided to go back on Wednesday when they were open, unannounced. And I started from the parking lot, moved my way into the building and unannounced with whatever normal music they had. Now, bear in mind, they don't normally use maximum volume. So my Monday test was actually worst case scenario. But on Wednesday night, I got numbers significantly less at every location. And so I think that Club Rodeo actually has done reasonably good job of controlling their sound. I have talked with our MABCD people, Chris Labrum and others, and I believe that they're in total compliance with the requirements that was laid out by the county commission. So there are some requirements and things they have to do. I believe they're doing those things. So I would like to just, if you will, speak, that they are a quality business in our community. Some people I don't go to these types of clubs, but I'm sure there's plenty of people that do, and it provides an opportunity for people. And I want to make sure that they're not, spoken ill of, like they're doing something wrong, because I don't think they are. I got to thinking about what else do they do. They have 60 employees, 10 of those are full-time. They have nearly $1 million in payroll per year. They have a number of community events they do. One of those is about suicide prevention for military members. It's called the Forgotten 22. They do that each year. They also have events for the ARC of Sedgwick County and Rainbows United. If you know what those organizations are, they set up events for them specifically. They pay $12,000 a month in sales tax and liquor taxes to the state and ultimately to the county. Some of that comes to us. And they pay $21,000 a year in property taxes as of right now. Having said all that, I want to just be very clear. I don't think they've done anything wrong. And I think back to when we approved the Club Rodeo zone change or whatever it was, again, under being a quasi-judicial role, if I understand correctly, and I don't think Justin's in the room, but my understanding is there's a preponderance of approval unless there's an opponent that can articulate a reason not to approve based on the 9 golden factors. That day, we had no opponents. The person that did complain is 1,500 feet from the nearest, their property is 1,500 feet from the edge of the parking lot at Club Rodeo. So they were not notified. There was an argument, maybe people didn't know about this and they would have engaged their opportunity. All I know is we have to follow the law. And in Sedgwick County, it's a 1,000-foot notification. So they did that. And then again, if you remember the public hearing, no one spoke in opposition. So I think we have some obligation essentially to allow them to use their property rights, which again, is a constitutional idea. I love property rights. I love to defend people's property rights. And if you're going to take those rights away, then there should be a good, valid reason to do so. But considering that public hearing, we had no way to add restrictions to what they did. They followed the process. They did their job. And they're following the letter to the law on what we put in front of them that day. They're doing the things that are required. So having said all that, I want to make sure that we're clear that I don't think Club Rodeo has done anything wrong. I think that they are a good community partner. And I wish them the best of success in their future. And I just want to make sure that everyone understands, because I think it may have been interpreted that I was attacking them in some way the previous meeting. I was simply trying to figure out what was going on. And having said all that, I don't think there's I have no desire right now to visit a sound ordinance, obviously. I don't think there's a problem for us to fix. So thank you, Chairman, for that chance to speak.
Okay. Thank you for that update. I'm glad that you did all that work. I am personal friends with Eric and Tracy Reagan that own it, and they did a great job out east, and I'm just glad that they provide a really nice asset for the community and choices for young people and even old people that are country fans. So thank you for that update. I have a quick, my other is that I'm reopening. I've got a couple of positions open for my Citizens Advisory Board, and so they will be taking applications if anybody's listening for the district that I serve in District 1. So there's a few openings. I'll be trying to fill those here in the coming weeks. So does anybody else have anything under other? And I don't see any. So, Madam Clerk, we do not have an executive session. And so with that, wish everybody a happy new year, and let's hope we can battle through the next chapter of this COVID world. So, but happy new year, and thank you, commissioners, and let's have a good year. We will be adjourned. Trying to be like you, Atlanta.
No, or maybe, Jim, I bet when you said that, you